Today we will be discussing bilirubin metabolism and cause of jaundice. So let's start. See, it first starts with the RBC lysis. From RBC we get hemoglobin. From hemoglobin, heme and globin are separated. And by breaking down heme, we get iron and protoporphyrin. So basically, see, the structure of heme is something like this. There is iron in the center, okay, and there is like protoporphyrin ring surrounding. So from this, iron is separated, which is stored, and the surrounding protoporphyrin ring is converted into unconjugated bilirubin. So all these steps, they occur in the blood. So the first cause of jaundice is hemolytic anemia. Okay, in hemolytic anemia there is excessive lysis of RBC. Okay, so we get more unconjugated bilirubin, which causes jaundice. From unconjugated bilirubin, we get conjugated bilirubin through help of the enzyme called uridine glucuronosyl transferase. Okay, or you can say UGT. See, all this orange part which is shown here, it occurs in the blood. Okay, and the conjugation process, it occurs in the liver. Okay, now see, we already discussed the first cause, that is hemolytic anemia. Okay, it can be due to any cause like hereditary spherocytosis or autoimmune anemia, okay, or any other cause. Now see, the remaining part, this part, it occurs in the liver. Okay, I have shown it in the blue color. Now see, the main thing is that unconjugated bilirubin, it is insoluble in water. Okay, while conjugated bilirubin, it is soluble in water. See how I remember is like this. See, let me write here. Unconjugated bilirubin, okay, unconjugated bilirubin is also called indirect bilirubin, and it is insoluble in water. Okay, insoluble in water. Unconjugated bilirubin is indirect bilirubin, and it is insoluble in water. So let's proceed further. See, the three causes of jaundice which are due to problem in uridine glucuronosyl transferase are Gilbert syndrome, okay, Crigler-Najjar syndrome, and physiologic jaundice of newborn. Okay, out of these, the most dangerous is Crigler-Najjar syndrome. Okay, because in this there is complete absence of UGT. Here we have complete absence of UGT, while in Gilbert syndrome we have decreased amount of UGT. Okay, so normally these patients are asymptomatic. Okay, but when they have either some kind of physical stress, okay, or mental stress, then in that condition they develop jaundice. Okay, all the question that I saw related to Gilbert syndrome always mention about having some kind of stress. Either it can be infection, okay, or it can be mental stress, it can be menstrual cycle, okay, or any other cause. You can say exercise, fasting, okay, or any other cause which causes some kind of stress to our body can result in jaundice, okay, in patients having Gilbert syndrome. Now the second one is Crigler-Najjar syndrome, in which there is complete absence of UGT. In this case, the only treatment option is liver transplant. Okay, there is no other way to save the patient. The third one is physiologic jaundice of newborn. In this, there is relative deficiency of UGT in first few days of life. Okay, let's suppose in a normal person, the ability of liver to conjugate bilirubin is suppose 100. Let's say liver is able to conjugate 100 molecules of bilirubin in 1 minute. Okay, but in this newborn, let's say their capacity is only 25. They can only conjugate 25 molecules of unconjugated bilirubin in 1 minute. So what about the rest of the unconjugated bilirubin? That unconjugated bilirubin will not be conjugated, and it will float around in the blood, okay, and will cause jaundice. So that's the reason of physiologic jaundice of newborn. And the treatment is obviously phototherapy. Okay, phototherapy, which acts like UGT. It converts the unconjugated bilirubin into conjugated bilirubin, and as we know that conjugated bilirubin is water soluble, it can be flushed out in the kidney. Okay, you can remove it from the body through kidney, and in this way unconjugated bilirubin will not deposit in all the places in the body like brain, basal ganglia, or anywhere else. So that's the treatment, phototherapy. Now from unconjugated bilirubin we make conjugated bilirubin in hepatocytes. Okay, from there it is transported into bile canaliculi. Okay, and here there is a necessary protein called membranous protein for transport. Okay, membranous protein. Now if there is defect in this protein, okay, then unconjugated bilirubin cannot be transferred into bile canaliculi, and in this way there is the unconjugated bilirubin will build up within the hepatocytes. Okay, and this will cause jaundice. The two classic cause in which you can see means problem with membranous protein is Dubin-Johnson syndrome and Rotor syndrome. In both of these, in Dubin-Johnson syndrome and Rotor syndrome, you cannot, okay, the body cannot transport conjugated bilirubin from hepatocyte into the bile canaliculi. So there will be buildup of conjugated bilirubin within the hepatocyte, and it will eventually go into the blood. Okay, so this will cause jaundice. Now all the congenital causes of jaundice, either it's Gilbert syndrome or Crigler-Najjar syndrome or Dubin-Johnson or Rotor syndrome, all of them are autosomal recessive. Okay, so just keep that in mind. Now from bile canaliculi, the bile along with the bilirubin will go into the bile duct. Okay, and from bile duct it will go into the duodenum. Okay, so here comes another cause of the jaundice. It is obstruction. Okay, if there is obstruction of bile duct, then conjugated bilirubin cannot go into the duodenum. Okay, it cannot go into the duodenum, and because of this the conjugated bilirubin will get back up here, means it will accumulate within the bile duct, bile canaliculi, and eventually it will rupture the bile duct and bile canaliculi. So that's one of the cause of jaundice. Okay, obstruction. And the two classic causes are gallstone. Okay, either it can be gallstone or carcinoma of head of pancreas. Both of these will cause obstruction in the bile duct. Okay, and you will see excess conjugated bilirubin. Okay, so these are the cause for in which you will see increased conjugated bilirubin. Now see, when bile duct when the conjugated bilirubin moves from bile duct into duodenum, okay, there it is converted into urobilinogen. Okay, the conjugated bilirubin is converted into urobilinogen. Now see, from the urobilinogen is formed in the small intestine. Okay, and the 80% of the urobilinogen it goes in the stool. Okay, 18% it is recirculated back into the liver, and 2% goes into the kidneys. Okay, so this 2% that is going in the kidney gives yellow color to the urine. Okay, it gives yellow color to the urine. Now one cause which I didn't mention, and it's one of the most important, is obviously hepatitis. Okay, in hepatitis there will be problem in the conjugation of the bilirubin, there will be problem with the transport of bilirubin. In short, there will be damage to hepatocytes as well as the bile canaliculi. Okay, so in this way hepatitis will also cause jaundice. Now the one of the most confusing thing for most of the student is what is the cause of color of urine in jaundice. Okay, in jaundice we obviously know that there is dark color of the urine. Okay, now what is the cause of this dark color of the urine? So let's try to understand it, means what caused the color of the urine. See, the color of the urine, the dark color of the urine, not in normal person it will always be due to urobilinogen. Okay, it will always be due to urobilinogen in normal person, but the people who are having jaundice, it can be, in those people it can be either due to urobilinogen or it can be due to conjugated bilirubin. So to know in which kind of jaundice what will cause the dark color of urine, we should ask two questions to ourselves. See, first ask the question, is there any damage to bile canaliculi or bile duct? See, is there damage to bile duct? Okay, if the answer is yes, it means the conjugated bilirubin from the bile duct is going into the blood, and once it reaches the blood, it will definitely go into the kidney. It will go into the kidney, obviously. So this will give the dark color to the urine. So see, first ask the question, is there damage? The answer is yes. So what are the causes in which you can see damage of the bile duct? See, there are only two causes. First one is hepatitis, okay, and the second one is obviously obstruction, in which there is backup of bile, okay, and that will cause rupture of the bile duct. So these are the only two causes in which you will see the dark color of urine due to conjugated bilirubin. So let me write here hepatitis, okay, and conjugated bilirubin. These are the two causes in which you will see dark color of urine due to conjugated bilirubin. Now the second question is this: is bilirubin reaching the duodenum? Is bilirubin reaching the duodenum? Okay, see, if the answer is yes, okay, if the answer is yes, that bilirubin is reaching duodenum, then we will see urobilinogen in urine, okay, urobilinogen in the urine, because see, without reaching duodenum the bilirubin cannot be converted into urobilinogen, okay, and so we will not see it in the urine. But in all the causes of jaundice in which the bilirubin is reaching the duodenum, we will definitely see dark color of urine due to urobilinogen. So which are the two causes in which we will see bilirubin reaching the duodenum? See, the first one is hepatitis. In hepatitis, the bilirubin is definitely reaching the duodenum. It will be less than the normal person, but still it is reaching. So the dark color of urine will also be due to urobilinogen. Another cause is hemolysis. In hemolysis, there is no problem with bile canaliculi or bile duct. So the bilirubin will reach the duodenum and it will be converted into urobilinogen, and that will give the dark color of urine. So the cause of dark color of urine due to urobilinogen are hepatitis, okay, and hemolytic anemia. So see, the dark color of urine due to conjugated bilirubin, the answer is hepatitis and obstruction. Obstruction, okay. The dark color of urine due to urobilinogen, the answer is hepatitis and hemolytic anemia. So this is all about the bilirubin metabolism and jaundice.